Hello everyone, it's Kurt Cocker, the registered nurse from Cape Ann Botanicals and Cape Ann Cannabis here in the North Shore of Massachusetts. I'd like to talk a little bit about the THC dosages that are so sought after in the cannabis marketplace, and also the understanding on how much THC is in a pre-roll joint, gummy, or drink, and how much of that THC do we really get. The first thing to remember, not everyone gets the same effect when using a cannabis product. It is very individualized experience for everyone. Secondly, the marketplace and users continue to concentrate on the THC percent or level. This is very similar to us looking at the alcohol percents for beer, wine, hard liquor. THC is only one of the compounds that are in the plant, and there are over 600 compounds that we currently know of. Most people can take 2 to 10 milligrams of cannabis with good result. We tell everyone to always start out low and increase until you get the desired effect. Be very careful with edibles though. The recreational or adult use serving size in Massachusetts is set at 5 milligrams per piece. So all gummies, drinks, and one piece of chocolate, not the whole chocolate bar, are 5 milligrams of THC. THC, tetrahydrocannabinol, is the main ingredient that causes the euphoric effect. We always recommend for people to start out with a half a gummy or half a piece of chocolate, or when smoking, just one hit, and consider that a dose. In flower, THC levels can be anywhere from 12% to 35% by dry volume here in Massachusetts. If we take a 1 gram pre-roll, which is 1,000 milligrams weight of flower, and it's 20% THC, that's 200 milligrams of THC in one pre-roll. Now, with combustion, we burn away, and there's side chain smoke that we also lose that escapes, that doesn't end up in our lungs. So we don't consume that whole 200 milligrams of THC in a pre-roll. On average, most of us get 4 to 7 milligrams of one hit or drag, and only a small amount of that percent gets to our brain. There are many different studies, but mainly we believe that you get about 12 to 50% of that 200 milligrams of THC. So that's only 24 to 37 milligrams THC, which most of us don't ever smoke a whole pre-roll. We do have to remember that other chemical compounds that are in the plant, like terpenoids and flavonoids, actually help and enhance this effect. I smoked a little bit of a strain called Clifford recently, and it was only 12% THC, but the terpene pinene that was in it caused me to have anxiety. And it wasn't just the THC percent that caused it. With any inhaled product or ingestion, you have to remember there's a variable how much percent of THC you're going to get. If you eat it or sublingual oils, it all has to pass through our digestive tract, and those are all different for all of us. We all have different metabolisms. As well, you should always understand that consumption methods will affect you differently. So a gummy or smoking a concentrate are two different methods, so be careful. Just a quick note, I'd also like to mention that big or little buds, it really makes no difference. A lot of the flower is sorted by machines in the industry now. So big buds are pulled out and small buds are pushed to the other sides. And some of the small buds are typically used for pre-rolls and other methods. But really when it comes down to it, they're exactly the same. If the small bud and the big buds are both 25% THC, they're the same quality. So don't get hung up on getting a small bud or big bud, as much as we all like to get a big bud in our packages. If you have any questions about dosaging or any other questions, please reach out to me or our staff. Thanks again for watching my video. There's a slide afterward that'll show you our websites. Please visit them. Take care.